This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and happy Mother's Day to all the moms.
That's right. And all the godmothers
and all,
the aunts.
Talk about the new normal.
Right, and all the aunts, everything.
That's right. Hopefully you send flowers because there's not a whole lot else you can do except get takeout.
Pears. We got pears.
That's right.
It's all good.
That's right. Anyway, we have another edition of Health Watch. Every Sunday we're here from 8 till 9 on Talk Radio 1210, WPHT. And as you heard the man say, Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates located in Marlton, New Jersey. We'll talk about what they do and why and how and when and where, all of that good stuff here on the program. Yes, we'll talk about COVID-19 and how it relates to what they do. So there's a lot to talk about here. And if you have a question for Dr. Molly, 855-839-1210, 855-839-1210. Dr. Molly will get into, the ins and outs of Innovative Medical Associates. But first, I know you wanted to address this, that people are saying or calling you and saying they'd like to come in, but can you do a virtual session? Let's think about this. Hydration is delivered via IV.
Right.
How do you put an IV in virtually over the phone or whatever?
Right. It's pretty difficult to do that. I mean, I can gather some facts. And in one case, a nice gentleman who's always calling us here, he had a lot of problems. And as a result, our lovely Nurse Barbara, sent him some information that he should get early this week. It was sent out on Friday. But, frankly, folks, this is the kind of thing that has to be done one-on-one. And it also allows me to really get a better handle on your present condition. When you're looking through the lens, you really don't get to see a patient, the coloring, things like that, the stuff that my docs all ask me about after our consult.
Yes.
So there are certain things that you just can't do virtually.
So we wanted people to understand that.
It's not that I don't want to.
Right,
it's
but you can't. I mean, you really
just can't, because I can't. Right, and I can't impart the information that I need to the medical staff either. So, and the nursing staff. I mean, really, we really want to see your records, and we want to go over those kinds of things. But it would be great for you to come in, and you're safe at our facility right now.
I was just going to ask you about that. Let's talk about that, because you were telling me before the show that you have this whole process done in the facility.
Yes.
And you can't go in for a day because
because we want that to lay on the non-porous surfaces, do what we have to do, and then go in and wipe down again with all of the antiviral kind of wipes that we use. So it can take a day. That's why we need Saturdays to do just that. And so you're really doing well. Plus, we do test. Everyone who comes in gets a look. You can't get past our foyer. We're going to do your temperature. We don't have to touch you to do that. You had it done, right, John?
Yes.
And, we're going to ask you, some things like, are you coughing more, whatever. And I don't mean for some of my patients who have a constant cough, because we know who you are. But again, we're going to ask for certain things like fever, et cetera.
Okay, Jim, we're going to tell that particular person thanks for the call, okay? So appreciate doing that. I had a little glitch here in the phone system, so we just wanted to address that. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, 855-839-1210 is our number here. And we're talking about just, Dr. Molly, your office and handling the situation of the coronavirus, and
we're testing our patients. We've tested the staff.
I've been under every week. By the way,
let me just say one other thing. My wonderful nurses are all on corona duty at various facilities throughout the region, and I talk to them. I find out what's going on, and before they'll come back to us, obviously we're going to test them, put them in their own little spot in terms of quarantine before they get back. So believe me, you can't imagine how quickly I want them back.
I know you do. And we wanted to mention, because we were talking about hydration, and we're trying to convey the safety of your office. And the other issue is, Dr. Molly, if you don't come in and you have several issues
that are not
that are
corona
not-
related.
that
You
are not
can't-
corona
look,
related.
everyone's hearing this large institution talk about cancer never stops. Well, neither does the side effects from all of the chemo drugs or the radiation and all those things that impede my patients' qualities of life. And the idea is we want to help our patients do some conventional if that's their choice. We have people who don't want to do conventional, and we'll treat them as well. You don't, let things go. But the point is, we really try to do everything according to Hoyle, according to the Department of Health. And by the way, if they all knew my RN, Barbara, who's running this, she's the infection control gal, as well as being the smartest person out there about nutraceuticals. I will tell you, nothing's getting past her.
Well, yes, she's pretty good at that stuff. The question is, though, when we're talking about your facility and people being afraid, my concern is that their conditions or their problems get worse.
Exactly right.
And so, they may be thinking that they're helping in one way, but maybe they're not helping in the other way.
Most important thing you do is help yourself right now.
Yes.
Because if your condition worsens and your quality of life goes down, what do you think happens to your immune system?
Weakens.
That's right, because the stress hormones are out there. So yes, please call. Please come in for the free consult. We're spacing them out. It's all good stuff.
All right. Again, 855-839-1210 is our number here. We want to do a quick overview of kind of the lay of the land as far as Innovative Medical Associates is concerned. The mainstay is hydration.
Right, it is
about.
hydration. Hydration is the main vehicle by which we use. We are a primary care facility, so if you need high blood pressure meds or you need an antibiotic or an antiviral for that matter, we're going to help you get it. My medical director, Dr. Test, is a great guy. There's no problem with that. We have Dr. Pat Cassiga, who was an anesthesiologist, so we really are in good shape in terms of the medical. So anything you could do at your primary care doc, you could do here. But our focus is on using the least amount of pharmaceutical necessary to correct your medical challenge, to help you get through it, and then not to impede your quality of life from the side effects of the pharmaceuticals. Isn't it bad enough you have a condition?
Yes.
Now you need 5 drugs on top of that with all of the side effects that go on and on and on if you see it on TV or if you see the little package insert in your medication. The idea is, and we want to do these things safely, so we're not just going to tell you throw your pills in the toilet and forget about them. No, we're going to help you reduce your need for the pharmaceuticals if possible. If it's not possible, then we're going to try to augment them with what we do to keep you feeling pretty darn good.
And you've had, I know in your career, you've had many different varieties of challenges that you've helped people with.
We started with cardiac
Yes,
and high lipids.
And
Yeah.
the number of protocols that you've developed is over 600.
That's right.
So the likelihood, we've
We
talked
have
a lot
a little
about,
something.
Yes, we've talked about cancer, we've talked about heart, we've talked about diabetes, but there's other things.
Sure, Lyme, all the autoimmune disorders. And there's so many new things on the horizon. One thing I know for sure, these nutraceuticals are old. They're God-given, right? God's ingredients. I always say that because it's true. But what's old is new again.
Yes.
You're going to see this, and it's happening everywhere. People are getting wise to this and wise to the quality of their nutraceuticals. And that's very, very important. We've all been trained to just take a pill and it's all going to go away. Well, we're finding with Corona that isn't happening, is it?
No, it's not. And you were talking a lot about some things that are old and is new again. I remember you mentioned frankincense many times.
That's right.
I remember that from my catechism studies
Well,
in grade
yeah,
school.
it's one of God's ingredients. It has
Right.
a high anti-inflammatory property. It's something we use extensively at our clinic. There's so many other. We could just start. Alpha lipoic acid's been around for years. These are the things. These are basic nutraceuticals or amino acids, things like that the body needs to work every day. Just think about how beautiful the body is designed. We're designed to get up every day and have energy to do what it is we love to do, as well as our work and loving other people. This is what it's all about. Quality of life, folks.
Yeah. I keep thinking about some of the things that you've mentioned. one day you mentioned, I still remember the name, ashwagandha. Is that
Ashwagandha, one of my
Ashwagandha,
favorite
yes.
herbs in the
Yeah,
whole world,
yeah.
and it's been around for thousands of years. Thousands of years. It's used extensively in Ayurvedic medicine, which is a form of Indian medicine that has been used for years, and some variations of the ashwagandha, not just from the India, but also Native Americans. I mean, there are just so many things.
So, in some way, shape, or form, it's possible that you may be getting some of these.
I do have them.
Yeah, you
I
have
do.
them,
I have
and-
the
and-
ability to secure them and good quality products as well.
And do they work? Is always
Oh,
the
my
question that you
gosh,
get.
yes.
Every
It's a-
time you get a
Well,
consultation.
here's the deal. Here's the deal. They don't necessarily work alone. They may work in tandem with other things. The beauty of the science that we do and the medicine that we do is that it works synergistically with God's ingredients. It works synergistically. There are many things that need to be put together to really form a protocol.
Okay, we're going to talk about one of your all-time favorites after the break, vitamin C.
That's great.
Which we're talking about immune systems and
Sure.
coronavirus, and this is a key
Sure.
to that. So we'll talk about that after the break. Our show is Health Watch, and we're here every Sunday, 8 till 9, Talk Radio 1210, WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. Again, our number here, if you have a question for Dr. Molly, 855-839-1210, 855-839-1210. We return. More of today's Health Watch after these words. Back here on Health Watch, as always, operators standing by at Innovative Medical Associates right now. You can call them at 856-489-0505. And when you call, you say, well, what do I do? Well, very simple. Ask them any question you'd like. You want more information, they'll do their best to accommodate you on that. And most importantly, if you want to make an appointment to sit down with Dr. Molly, the initial consultation is complimentary. All you have to do is call that number to set it up, 856-489-0505. You can call now. You can call after we leave you at 9. You can call tomorrow. Whenever you call, that's the number, 856-489-0505. And our website is up and running.
Yeah.
Yes.
Yes.
Finally, okay? No, the website didn't have the COVID-19. No. It was just we worked on it, and finally it's up. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. Some good information on that as well. Our program is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. We're going to talk to Rita in West Deptford, New Jersey. Rita, good morning. You're on with Dr. Molly.
Hi, Rita.
Oh, hi. Hello. I listen to Dr. Molly every week, and I
Very
wanted
good.
to ask,
Thank
Yeah,
you. Thank you. Thank you.
I love your show, about red yeast rice.
Oh, I love it. How you doing on it?
Love it. Okay, good.
Good.
Because
Good.
my doctor had put me on it for
Good. Good.
trying.
You have a progressive thinking doctor. Good.
Oh, good. Well, that's all I wanted you to say is that it was an okay thing to take.
It
and
is. It is. And
CoQ10 and the red yeast rice. That's what I'm-
CoQ10 is very important because let me explain something about red yeast rice. Although it's one of God's ingredients, it can have an effect on the liver, and I'm sure your doctor told you that. So he's probably going to watch your liver enzymes very carefully. I know that's what Dr. Testa would do at my place. And the CoQ10, see, part of the issue with anything that works in the same manner as a statin, even though it's much more tolerated than statins. Actually, I believe our John is on it as
yes,
well.
I am. Thanks to
And,
you.
Yeah. And I would tell you that, he's going to watch your liver enzymes anyway, and you should too. You make sure you get them done at least twice a year, maybe even more if you go in more often. And
go in
good. And the CoQ10 is very, very important because that category, even in the natural substance, can help deplete the CoQ10, which is very needed for the myocardial function. Very important. And if you want to read about CoQ10 and that, probably one of the definitive things that was written was from Dr. Sinatra, not to be confused with Sid Mark Sinatra, but he did a lot of the work in his early days on the coenzyme Q10. And you do want an ubiquitous ubiquitous CoQ10, and there's plenty out there. Okay.
Okay, Dr. Molly, but the red yeast rice really doesn't. If you have a healthy liver, it doesn't hurt it. Does it?
Yeah, I know that, but you know what? After a certain point, anything that it doesn't hurt it. No. But it can change the liver enzymes. Here's the deal. Dr. Molly is proactive, right? Anything that is statin-like, all right, we just want to be on top of things, all right? In my experience, as long as your immune system is great and good, you're not going to have a problem. But, we also want to take care of our patients in the long run, and we don't throw traditional things out with the natural. So, yeah, you're doing a great thing. It's good. I love it.
Yeah,
You're
Rita.
going to have less trouble on that than anything else, is what I'm saying.
As Dr. Molly said, I'm on it myself, along with the CoQ10, and it's been fine because all of these statin drugs are not good for me. I just can't tolerate
in
them.
any way. And what's interesting is in John's case, Dr. Testa had to wrangle his cardiologist into doing it. So, yeah, I'm with you. Okay. You're a smart lady, Rita. Keep it up.
Oh, thank you so much.
Rita, thanks a lot for the call.
That's a great call.
And the kind words, yeah. Well, that's really what happened
for me. And again,
me.
I don't want to say that red yeast rice causes a problem, but you want to be on top of it because the mechanism is similar to the statin. It's not exactly the same because it's a more natural product. It makes sense. But we also want to make sure that your lipids are under control, right? So it's prudent to run the blood work and also make sure the liver is functioning at an optimal level. That's all.
Okay.
Rita's on it.
That's good. 855-839-1210. We're going to talk about vitamin C.
My favorite.
And I know you have a couple of articles that you want to talk about that really address this.
You know what? We talk about vitamin C all the time. You always talk about your cold situation and this and that.
Yes.
And vitamin C came up both in a pejorative manner in terms of the COVID virus because people were saying it was a cure for COVID. It isn't. But it's an interesting thing because if people go on to something called PubMed, that is a traditional website that actually has abstracts and articles talking about various studies that have been done from various institutions, not just people who have an interest in alternative, but through the NIH and that kind of thing. Interestingly enough, there's an abstract from 2012. Now think about this, 2012, talking about vitamin C plus zinc against the common cold. And what it showed, even back then, it could be more effective than a placebo than not. So it's a double-blind study at that, okay? After 5 days of treatment, it reduced the symptoms and shortened the length of the cold. Now, that's good. It doesn't cure the cold. It shortens the length and helps you feel better through it. So that's an interesting article.
Yes.
Right?
And we've been talking about this, and I mention all the time that I hardly ever get a cold, and if I get one, it's very, very slight, and it goes away right away. And one of your patients said to you, "Hey, wait a minute, John's not the only one that never gets a cold."
That's right. They said, put me on the air.
I never get one either. So
I know.
obviously it's an effect for a lot of people.
Except he doesn't get up as early as you.
That's
okay.
Right. There you go.
So I'm with you on that. There's another article that's also very interesting. It talks about vitamin C and male fertility. Now, it's very interesting because I actually have a young man. You guys know I've spoken about this last week in terms of anabolic steroids and the terrible thing taking these anabolic steroids do to guys' bodies. Well, it does affect their sperm. And what we want to talk about is the use of vitamin C and zinc can really up their true biological, their human testosterone levels, and also then help the sperm count as well as motility. And those are two of the things we need, obviously, in terms of conception. Go ahead, John.
Okay. No,
Question, right?
It's interesting that we're finding other things. Now, when you're taking the vitamin C,
yes,
is it a good idea to take zinc as well?
Well, what I want people to understand is I'm not prescribing them to run out and buy vitamin C and zinc tablets. I think it's important to sort of get a level on trace minerals and see where you are. But what is very, very interesting from the perspective of where I sit is that when I test trace minerals in our facility with traditional blood testing, generally they're low in men. And zinc is extremely important for men. Extremely.
Why?
Because it helps with the testosterone production. It helps on a cellular level. So this is one of the things I look at. And another interesting piece, if we think about it, we talked about vitamin C and zinc for the colds. And if you think back to the early days of Corona, meaning when it first started and hitting, everybody was putting together these supplements of vitamin C and zinc because zinc has an ability to help protect the cells from the viruses. But we cannot say that it is a total protection from virus. It doesn't cure it. But it definitely can help your immune system. It helps utilize the cells that come back and fight all kinds of foreign invaders from the body.
Which would make you hopefully less likely to contact.
That's right. Yes. Or certainly hopefully shorten the duration of things like the cold virus and other viruses that are respiratory in nature. And we've used it at our facility. Again, shortening length and improving quality of life.
You know, I had a friend of mine who texted me and said she listens to us and she thinks that you're really right on with a lot of things. And she said, you talked about vitamin C. I'm giving it to my dogs.
And I think that's great, except I want you to realize, get yourself pet vitamins, please. I have a very, very dear friend who runs a mobile vet service who's a wonderful gal, Dr. Laurie from Marlton. She's a great gal, smart as a whip. You don't use things that you don't know, because a lot of this stuff is coming from China, and you all remember what happened to our beloved pets with some of the Chinese stuff. So you want to make sure you use a good quality product for them, just the way I say about us. So I treat, I have Gracie, our little therapy dog, and believe me, I treat her just like I would a patient. So I'm with you. In fact, she just went to her doc to get a chiropractic adjustment.
Yes.
All right?
Yes.
So, yes,
Gracie,
I agree with your friend.
The only dog who carries her own leash.
Yeah, you saw it today. It's amazing. We're doing it for my place today, so it's a good deal. So let's go back to vitamin C.
Well, we're coming on a break, and then we'll pick that up after the break. And I know you wanted to talk about stem cells, too.
Yes.
Because that's also important.
Sure, and it's something that's on our website.
Exactly. So we'll get to that.
Good.
It is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. And I'm your host, John DeMasi. Questions for Dr. Molly, 855-839-1210 is our number here, 855-839-1210. We return. More of today's Health Watch after these words. All right, we're back here on Health Watch. Operator standing by right now at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. You have a question for the operators, feel free to ask it. Call them and ask it. You want to sit down with Dr. Molly and schedule an appointment? Remember, the initial consultation is complimentary. All you have to do is just call and schedule. It's pretty simple. Also, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. We spent several months putting that together, so a lot of good information on that where you can get a little more educated. And also, a reminder that we have our Health Watch replay every Sunday, 4 until 5 p.m., You can hear this show again this afternoon, 4 to 5, right here on Talk Radio 1210 WPHT. And, of course, it's our live version of Health Watch right now. 855-839-1210 is our number here in the studio. Let's go to the phones. Gene is in Roxborough. Gene, good morning. You're on with Dr. Molly.
Good morning, Gene.
Good morning.
How are you, sir?
All right. How are you?
Good.
I had a technical question. How do the blood vessels hold up to the IV procedure, having it done like twice a week?
I'm sorry, Gene. I'm having a hard time hearing you.
Hold
but
on.
Let's see if
Gene, see if I think I interpreted it. How do the blood vessels hold up with the IV treatment twice a week? Is that what your question was?
Exactly.
Okay.
Okay, good. That's a good question. I can tell you that we buffer our vitamin C nicely. I think John's a good example of people coming in at least once a week forever. I would say, John,
20 years.
20 years, and his veins are doing pretty well. The question is, look, a lot of that's going to depend on what's the underlying condition. Obviously, if someone has a vascular condition, whatever. But honestly, in 23 years that we've been doing it, for the most part, most people do well, because remember, it's twice a week for a finite period of time. That's usually what goes on, because it depends on how many treatments over what length of time, what's the underlying conditions we're trying to treat in terms of the quality of life, and where we go from there. Now, I would tell you the same good question is probably a good question to talk to the oncology departments about in terms of how they deliver the chemo. Now, I realize they'll use the port. Now, we do not use a patient's port. I want to put that right out. Basically because that is something that is put in, it's surgically put in, and we're not going to mess with that. We are going to continue to use your venous system in the arms, obviously. We don't use it anywhere else. And bottom line is, honestly, in 23 years, I don't think we've had a tremendous problem with it. And if someone needs a break, we give them a break. I think the most important thing is the hydration. And I'm talking about hydration in terms of when they come in to see us as well. So I hope that answers your question. Thank you, Gene. Thank you, Gene. You're
Gene,
a very
thanks
smart
a lot for
guy.
the call. Appreciate
Thank you.
it.
Right.
Yeah, that is a good question.
It is
because
an excellent question. And again, if you're thinking about this in terms of a finite amount of treatments, 30 treatments over 15 weeks, and then you back down to once a week, and you're in here once a week for 20 years. I don't know how, except for sometimes when you're away, which, you take a break.
Right.
But honestly, and I would say it also depends on the skill of the phlebotomists and the nurses, which, gosh knows, I really try to get the best.
You do.
And I've had Linda, I've had people with us for a very long time.
Yes.
And the other thing is the infection control. I really believe it's so important to really take our hat off to our registered nurse, Barbara, who oversees a lot of this. And, of course, my other nurses when they get back from COVID.
Yes.
But, we're on it.
You ask Barbara any question about a supplement.
Oh, that's a whole other issue.
That's like an encyclopedia.
That's an encyclopedia on and of itself. So let's go back to vitamin C for a minute.
855-839-1210 is our number here. Vitamin C, and we talked about zinc.
Yes.
I mean, is it pretty much good for everything?
Well, I like to call it a universal antioxidant, but it's also a pro-oxidant. And one of the things if you go on this PubMed, you'll see some abstracts related to wound healing, because vitamin C actually helps with the production of collagen. That's part of the connective tissue. So it's part of the process that God put in place. The other thing is, people run around, and women, we're the ones. Well, we got a sizable amount of guys. You know that our Dr. Testa has a laser. He loves doing skin laser, okay? I say to him all the time, and he says, Dr. Molly, you're right. When your gals come in for the laser treatments, they really ought to sit down for some hydration with the vitamin C, because it will continue to do what? Help produce the collagen that brings in fresh skin cells, etc. So believe me, there's a place even for vitamin C in cosmetic. Okay, so
I wanted to ask you. You mentioned a wound.
Wound healing, yes.
Wound healing, because it reminded me many years ago I lost an uncle who had a wound that never healed.
Yes.
And he went into the hospital for some procedure, and he ended up dying there.
Yeah, probably from infection.
Exactly.
Yeah.
So talk about that aspect.
Well,
of it.
what it does is it stimulates wound healing, because it forms collagen as well. But it also works by helping the platelets. So there's a twofold action there. And actually, we're going to talk a little more about that when we get into the stem cells today.
Yes, we're gonna talk about that after the next break.
Right.
We'll talk about stem cells.
And in addition, I want to say something. Vitamin C is known to help with the progression of macular degeneration. Now, we all know that there have been many strides from the beginning. And 10 years ago, 20 years ago, they didn't have anything for macular degeneration.
Yes.
Now we have eye shots and things like that. But back when we started, there wasn't much. And we were able to help people with macular degeneration and certainly slow the progression with vitamin C and certain other minerals and things put together in the IVs that actually help slow the progression. And right now, till today, even though people do the traditional treatment for macular, and I like to call it MAC, the Big Mac, what we like to do is sit them in the chair and augment that with the vitamin C to help, again, slow the progression because it's a terrible condition.
It sounds like when you talk about it, and you've done this before, that, I mean, vitamin C has so many uses.
Vitamin C is a universal. God knew what he was doing when he put it in our fruits and vegetables. And there are so many. Of course, vitamin C is vitamin C is vitamin C. But I will tell you, I truly believe God gave a gift to the body because it is able to really really see the difference in the form of vitamin C that you get. Like, for example, we use fresh extracts. We use food extracts, tapioca for one. We use as much vitamin C as we can. We also use it from beets in certain conditions. Okay, so again, you're going to find that the vitamin C, if the body perceives this as a food product, man, does it utilize it.
People say to you, Dr. Molly, I take vitamin C. I eat fruits and vegetables, and I take the vitamin C tablets.
Sure.
So I don't need the hydration.
Well, great. I hope that's true, but I would tell you, you don't even know how much vitamin C you're using. And remember, I always hear from the naysayers and the physicians who really like to go out there and stonewall my docs and say, well, you know, vitamin C is water soluble, therefore you urinate it out. Yeah, okay. In our condition, you're going to urinate it out, okay, but it's only the excess. The reserve is going to be there because of the way we're delivering it and in the amounts that we're able to deliver.
Yeah, I noticed that, and I meant to ask you that.
There
question,
it is. It's,
because I've heard that from
Sure.
some naysayers say to me, well, you guys are talking about that vitamin C,
yeah.
but you go to the bathroom a lot after that. I said, yeah, as a matter of fact, I do.
Yeah.
But now you've
guess
explained
what?
it. Yeah.
What about your reserve? What's left over is what's important.
Exactly.
The other thing is, remember, when you ingest vitamin C, John, you get gastric upset. So there's a good possibility that you're going to have more loose stools, those kinds of things. Some people, that's good because you're detoxing, no problem. But it's vitamin C IV doesn't usually give you that.
All right. We are coming up on our final break of the morning, and we still have time to take your question or two. So if you want to call in, now's the time to do it, 855-839-1210. Right after the break, Dr. Molly's going to talk about stem cells because she's had a great deal of success with some patients with that, and we'll continue to talk about that. 855-839-1210 is the number. The show with Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Again, our number, 855-839-1210. With Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates. I'm your host, John DeMasi. More Health Watch after these words. Back here on Health Watch, again, operators are standing by at Innovative Medical Associates. 856-489-0505 is the number. That is the number for Innovative Medical all during the week. So if you want to call tomorrow or the next day, 856-489-0505. Operators will be there pretty much all day, so after we leave you at 9 o'clock this morning, you can call 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. A lot of good information on that as well. And also a reminder, you miss any of today's show, you want to hear it this afternoon or you want to hear it again in its entirety, it's the Health Watch replay Sundays 4 till 5 here on Talk Radio 1210 WPHT. Again, our show is Health Watch every Sunday, the live version, 8 till 9, here on Talk Radio 1210, WPHT. Let's go to the phones. Eleanor is in Northeast Philadelphia. Eleanor, good morning. You're on with Dr. Molly.
Good morning,
Hi, Eleanor. How are you?
Okay, thank you.
Good.
Doctor, I'm going to be 89 this month.
God bless you.
And it's not very, very difficult to be 89. It just comes up on you.
No. You did something good in life. When the good
I don't
Lord
know
gives
where
you
it
a
came
long
from.
life, you're a good woman. Okay.
I don't even feel like it's a long life.
Good girl. That's what I want to hear. That's right.
Anyway, doctor, I have macula.
Okay.
And
Which
I've
kind?
been taking
Drusen's?
something-
Wait, Druzins? Which one, dry or wet?
It's one was wet and one was dry, but now the wet one is better than the left one. The left one has dark spots on it. Yeah. Anyway, I've been taking something called I Promise a long time. It comes from Missouri or something.
That's good.
Quite a few years. Yes.
What's in it?
Well, that's what I want to know because I've just switched to Precivision, Arids 2. Both of them say Arids 2. Okay. And I find that they both have different formulas.
Well,
like
yes.
the Arids, this one has it's hard to see. It has, in fact, I have to use it's it's Arids 2 plus zinc free.
Yes.
So which I probably am not that crazy about now, but it has in it. It's very hard for me to see.
Okay.
I have to hold it up with a magnifying.
I'm pretty familiar with that product, but let me tell you. Yes, let me tell you something. The idea is really it's the minerals too. I mean, you can't. In other words, when I say vitamin C, I'm saying vitamin C along with other things. But
yeah, they both have it. They both have it, but
of
the
course they
Arids
do.
2 that I'm taking now, the Precivision, it's completely different. It's a soft gel.
Yes,
and
probably
it has
better.
D, E, zinc, copper, lutein, and zexo.
Yeah,
I don't know what that is. The other one is not that way. I couldn't read it because the one is very, very small.
Well, let me tell you.
The other one has.
Hold on, Eleanor. Let Dr. Molly. She's got a thought on that. Hold on.
Okay, I think the soft gel is probably better because you're going to get more absorbability from that. So try it for.
They're both.
Oh, good. More absorption from the soft gel. So I think that the mechanism is good. The question is, does it have enough of the? I'm not familiar with the one from Missouri, but you made me aware of it, and I'll look it up. But
I'll tell you what it is. It's fish oil, 70%. And,
well, that's good, actually.
C, ascorbic acid, D, E, fish oil.
Okay.
Omega fatty. And mixed tropicals, alpha lipstick.
That's vitamin E. Yeah, listen, that's a good product, but I think I would use both products. Listen, it can't hurt you to take both.
What about
products.
hydration, Dr.
And
Molly?
she'd be doing very well if she came in and we could give her a boost of that vitamin C and the minerals. Again, we have a protocol for the macular, and I'd love to talk more about that off the air with you.
Yeah.
If you call the office,
now.
I'm sure my girl Barbara will be happy to talk to you.
But I will eventually call.
Good.
Okay.
Good.
With the Precivision, though?
I think so. I think it sounds like it's a great product. I'd use them both. Listen, when you have what you have, I'd try everything.
Yeah. Eleanor,
God bless you.
Thank you. Thank you, and good luck with that, and thanks a lot for the call. We appreciate it. Candidate for
you know
hydration.
What I heard? I actually heard somebody was working on something, not here, but in another area in the West Coast where they're always doing something for an alternative therapy with stem cells. So, we're going to talk a little bit about those right now.
Yes, we've got a couple minutes left of the show.
Okay.
Stem cells, you've had a lot of success with them.
I have. And one of the thing is, I want to say it's an alternative proven therapy. By that, proven for minimizing most pain syndromes. So I asked our website to make sure that they include stem cells under our pain management stuff because it helps do what? It helps with arthritis, degenerative joint disease, autoimmune diseases, and it reduces my dear old foe, inflammation. Inflammation is the culprit. But I think from our perspective, I want people to understand that I'm very particular about the stem cell process. Being a scientist, I really wanted to look at this because we get this from natural materials from fully free delivered donors. Okay, so post-birth tissue. And I'm very, very particular about it having no red blood cells and making sure that we get rid of membranes that can actually cause cross-contamination to the donor. And if you remember a little while back, one company had a lot of problems with it.
Yes, they did.
And I'm very particular because we look for that. And I will tell you, I give a lot of credit to my medical directors, both Kasica and Testa, for helping me weed out these because I am like a nut about what we're giving in the clinic. Also, we've had tremendous success using this not only with the pain syndromes, but also with respiratory issues. For example, the COPD patients I've had have had marked improvement, and we do this by testing, by doing the pulmonary testing. And of course, we're working with a particular patient right now with neurodegenerative PSP. And of course, one of my medical people, Dr. Pat Kaska, uses it for her MS. So I want people to understand stem cells in and of themselves are good, but the way we do them, followed by the cytokines, the growth factors, the amino acids in the hydration, so that our protocol is all-inclusive. We don't just give you the stem cells to say, go on your way. We actually augment those with the hydration. And I want to liken it to seeding for your grass seed. You put it down, but you better water it. You better give it the fertilizer and everything it needs to help grow.
Well, that makes sense.
It does.
By the way, you mentioned the patient with the neurodegenerative problem. How is she doing? Because I remember she couldn't walk when she first started this.
She's walking with help. I mean, there's not much research on it because it's a very obscure disease, and it's one of those rare diseases that we don't want to put a lot of money in. So any good day for her is a win. Any good day for her is a win.
Yeah, but when she first came in, I get the benefit of sitting there once a week and seeing some of the patients, and then when you talk about them, then I picture them in my head, and I remember she had a real problem sitting in the chair. She needed help. Now it's,
I'm going to tell you something about our COPD patient. When he had this COPD issues from smoking heavily and living a certain cavalier lifestyle.
Yes.
Bottom line is now the only thing he's worried about is his testosterone. Okay? So that tells you how much improvement there's been on the lung side of the house. And, that's all I can say.
Well, that's a good note to end the show on. That is going to put the wraps on another edition of Health Watch. Don't forget, if you have a question for Dr. Molly or you'd like to make an appointment, 856-489-0505 is her number. 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, you can hear a replay of today's show this afternoon from 4 until 5, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Dee, and of course our nurses, Jess, Michelle, Crystal, and our medical assistant, Kathy. I'm your host, John DeMasi. Thanks very much for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9 a.m. here on Talk Radio 1210 WPHT. You take